Pseudomonas. In this lecture, we are concentrating on medically important species in Pseudomonas, that is Pseudomonas aeruginosa. According to Burgess classification, these organisms kingdom Bacteria, phylum Proteobacteria, class Gamma Proteobacteria, order Pseudomonadales, family Pseudomonadidaceae, genus Pseudomonas, species aeruginosa. And in gram stain micrograph we can see this organisms as bacilli which are pink in color, pink or red in color, and most of the times you can see this organism in pairs, rod shaped bacilli in gram negative bacilli in pairs, and sometimes we can see this organism in bunches even. These are gram negative rods, motile free living bacteria, and these organisms are aerobic. They have catalase enzymes, superoxide dismutase enzymes, and these are oxidase positive. They have a cytochrome C oxidase enzyme in them, so they will make a lot of ATPs by using cytochrome C oxidase. So because of having this oxidase enzyme, cytochrome C oxidase, these organisms are non-fermenters. They won't ferment majority of the sugars including lactose. These organisms are non-lactose fermenters, and these are catalase positive organisms, and these organisms won't require any nutrients for its growth. They won't require any major growth factors for this growth. They can grow in distilled water even with minimal requirements. These organisms can grow comfortably, and these organisms are resistant to high temperatures at even up to 42 degrees centigrade temperatures, and they are best grown at 37 degrees centigrade temperatures. And these organisms are resistant to salts, dyes, weak antiseptics like contact lens solutions, and they are most commonly resistant to antibiotics which are normally used. Normally used antibiotics are resistant. This organism is resistant to normally used antibiotics, and these organisms can secrete two water soluble pigments. One is pyoviridin, which is fluorescent pigment, and the other one is pyocyanin, which is a blue pigment, and these two pigments also play a major role in virulence of these organisms. And by having these two pigments, these organisms, whenever they grow on culture mediums, they appear as blue-green colonies, and in some skin infections we can see, because of these two pigment secretions, these skin infected lesions are pus that are draining from the infected lesions always can look like a bluish green appearance. And these organisms are having antibiotic resistance, and they'll get this resistance because of getting the gene by transduction and conjugation, horizontal gene transfers. And these organisms can carry plasmids with them which have this resistant gene. And these organisms on blood agar, they are beta hemolytic, and the colonies that are grown on the culture media always produce a fruity odor. Virulent factors. Colonization is mainly by pili and flagella, especially the pili attaches to galactose or mannose or sialic acid receptors on host cells, and these organisms can also secrete a protease enzyme that cleaves fibronectin on human respiratory epithelial cells. Whenever it cleaves fibronectin, the mucosal epithelial cells will be exposed, and these pili will go and attaches to that exposed mucosal epithelial receptor areas. This organism can secrete an alginate material, which is nothing but exopolysaccharide material, carbohydrate material, and this alginate consists of manuric and glucuronic acid, which is nothing but an alginate. And many of the mucoid stains of Pseudomonas aeruginosa, they can produce this alginate material, Especially this alginate material producing organism causes respiratory tract infections, especially in cystic fibrosis cases, and this alginate material makes a biofilm in the respiratory tract so that many of this organism can make a lot of microcolonies, and these biofilms are resistant to lymphocytes, they inhibit phagocytes, ciliary action of the respiratory tract, they inhibit antibodies, they can inhibit complement activity, and they can inhibit antibiotic action even. So the biofilm, because of biofilm, these organisms become resistant, especially in cystic fibrosis cases. Very hard to treat, and the prognosis is also very poor in cystic fibrosis cases because of Pseudomonas infection. These organisms can secrete exoenzyme S, which helps in attaching to the glycolipid receptors on respiratory epithelial cells. So colonization basically occurs with the help of pili, with the help of alginate material, with the help of exoenzyme S, and flagella that are present for these organisms. Invasion. Invasion can occur with the help of elastase enzyme that is secreted by this organism. This elastase enzyme cleaves collagen, IgG antibodies, IgA antibodies, and complement so that it can suppress the immune activity. And this elastase enzyme can degrade fibronectin on the respiratory mucosa so that the mucosal receptors will get exposed. Whenever this fibronectin is removed from the respiratory epithelial cells, the mucosal receptors for the pili will get exposed so that this organism will bind to the respiratory epithelium. And this elastase can disrupt ciliary action on respiratory epithelium so that it disrupts ciliated respiratory epithelium. These organisms can also secrete alkaline protease, which interferes with fibrin formation, and the fibrin will get degraded. So both this elastase and alkaline protease destruct corneal areas by disturbing the collagen material and ground substance in that areas, and they can also inhibit interferon gamma and tumor necrosis factor. They can secrete cytotoxins, which is a pore forming toxin, majorly affects neutrophils, and this cytotoxin can be toxic to majority of the mammalian cells. These organisms can secrete two hemolysins. One is phospholipase and other one is lecithinase. These two hemolysins can damage the red blood cells and other epithelial cells, so by breaking the lipids and lecithin on the membranes of mammalian cells. These organisms can secrete two soluble pigments. One is pyocyanin, which is blue in nature, blue in color. It is effective against staph aureus because this pyocyanin acts as an antibiotic for staph aureus, so that these organisms can suppress the staph aureus in cystic fibrosis cases, and these organisms can cause respiratory tract infection majorly in cystic fibrosis cases by dominating the staph aureus organisms. They can secrete one more water soluble pigment, that is pyoviridin, which is a fluorescence in color, and this pyoviridin always helps this organism to acquire iron, and this pyoviridin can also prevent the ciliary action. It is ciliostatic. Dissemination can occur majorly by toxins which are secreted by this organism. It can secrete endotoxin because this is a gram-negative organism. The outer membrane acts as a endotoxin. The lipid A material of endotoxin LPS or outer membrane can act as endotoxin, which can be referred as LPS, lipid polysaccharide, and this endotoxin can damage the endothelial cells of the blood vessels so that we can see intravascular coagulation that can ultimately lead to hypertension and organ failure, and that can lead to shock conditions. And because of endotoxin, we can see the initial colonization and the systemic effects. Antibodies which are produced against this endotoxin can protect the human being from getting this infection or from this infection. exoenzyme S, which is a A and B type of toxin, and this exoenzyme S impairs protein synthesis by ADP ribosylation of many cells, and it inhibits the phagocytotic activity. Especially this exoenzyme S is widely seen in burns patients, widely secreting from this organism, especially in burns patients. Exotoxin A, which is also an A and B toxin, and this exotoxin A always has similar function as diphtheria toxin by adding ADP ribose to the elongation factor 2. It inhibits protein synthesis, same like diphtheria toxin, but the receptors for this exotoxin A is different from diphtheria toxin, and this exotoxin A is majorly toxic to liver cells when compared to diphtheria toxin. Diphtheria toxin is normally toxic to kidney cells, heart and neural tissues, whereas exotoxin A is toxic to liver cells. Epidemiology. These organisms are ubiquitous, can be seen in soil, water and air. 3 to 4% of non-hospitalized patients have this organism on their skin and the GI tract, especially in stools. And it is one of the major opportunistic pathogen. In immune suppressed individual, this organism takes a lead and causes the infection. In hospitals, these organisms are seen in disinfectants, respiratory equipments, food, sinks, taps, toilets, showers and mops, or any kind of catheter instrumentation. Also we can see this organism, foul catheters. And hospitals get this organism by fruits, vegetables and by visitors, or the hospital normally getting contaminated with these organisms. And it is the common cause of hot tub folliculitis, and it is the third most common cause of urinary tract infections, and commonly causes bacterial keratitis, eye infections. And the predisposing factors are mainly immune suppressed individuals or immune compromised individuals like burns patients, cancer patients, cystic fibrosis patients, and you can see these organisms in hospitalized patients. Pathogenesis. Here we can see the animated version of pathogenesis. So the entry of these organisms can be through respiratory tract, or it can be through the food, or it can be through with the help of any trauma, or by any surgical injuries or surgical conditions can lead to get these infections, or we can get this infection in people who are IV drug abusers, or people who are using catheters, respiratory catheters or urinary catheters, or by any kind of injuries we can get these infections. So the organism enters into the human body through any of these routes. So once they enter into the body, here there is the epithelial cells, and this is the blood vessels, and these are the organisms. The red color ones are the Pseudomonas organisms, and these Pseudomonas organisms always attaches to the epithelial cells with the help of pili, with the help of glycocalyx, that is biofilm or alginate material, or by alginate slime layer that makes the biofilm in the respiratory tract of cystic fibrosis cases. With all these material, even with exoenzyme S can also help this organism in attachment. So these organism attaches to the epithelial cells. Once they attach to the epithelial cell, they secrete invasins. So the invasins are elastase, alkaline protease, hemolysins, cytotoxins and pigments, pyocyanin and pyoviridin pigments. Because of all these materials, these organisms can inhibit phagocytosis, antibiotic activity, antibodies activity, complement activity. So with the help of alginate material, biofilm, these organisms can inhibit everything from the immune system. So after this, the organisms they destruct the epithelial cells and they will start to enter into the bloodstream. Once they enters into the bloodstream, they can also secrete a lot of toxins. Whenever they secrete these toxins like exoenzyme S, exotoxin A, and LPS, lipopolysaccharide, are endotoxins. They can destruct the blood vessels, they destruct the neighboring cells, so they can cause systemic conditions. So clinical conditions caused by Pseudomonas aeruginosa. It can cause pneumonia, especially in immune suppressed individuals like leukemic patients or burns patients or hospitalized patients, or majorly in cystic fibrosis cases. The pneumonia is a sudden onset with high fever, chills, and we can see consolidated lungs, we can see blood tinged sputum, we can see cavity formations, we can see abscess inside the respiratory tract, lung tissues. And these organisms can also cause endocarditis, especially in people who are already suffering with valvular disease or IV drug abuse patients. We can see endocarditis. Especially IV drug abuse patients, we can see the valves, the tricuspid valves will always have vegetations, and we can see pneumonia in these patients, even IV drug abuse patients. And we can see CNS infections, especially in people who got the accidents or traumas or head injuries, or people who got this infection hematogenously by urinary catheters or by IV drug abuse. We can see CNS infections like meningitis and encephalopathy. And especially in CNS infections, we can see patients having high fever with headache, stiff neck, when they will have Burzynski sign, and ultimately untreated patients, they will show seizures, and ultimately shock and death can also occur because of these infections. This organism is the third most common cause of urinary tract infections, especially in people who are having the urinary catheters, foul urinary catheters for a prolonged period, or people who are having who are exposed to instrumentations, unsterile surgical instrumentations. These people majorly get the urinary tract infections, and these urinary tract infections, especially when compared with E. coli in urinary tract infections always can spread to the upper part of urinary tract areas, whereas these organisms can, in this urinary tract infection by Pseudomonas aeruginosa, we can always see, because of damage of urinary tract epithelium by using foul urinary catheters or instruments, unsterile instruments, these organisms enters into the tissues and they'll straight away enters into the bloodstream, and we can see bacteremia. It can it can lead to cause meningitis or CNS infections or bone infections, etc. And this organism is the third most common cause of urinary tract infection in hospitalized patients. It can cause external ear infections. We can call it as external otitis. Especially we can see this external otitis in people who are swimming in contaminated waters. These organisms can grow in waters, any wet areas, or people who are unhygienic having these organisms on their skin, or people who are immune suppressed. We can see this external otitis. So in these external otitis, majority of the time the patients who are majorly the children who are having this infection, whenever they sleep, we can see the pus oozing from the ear areas, and it is causing wettening of the pillows. And if untreated, external otitis conditions can lead to cause mastoid bone infections, and this infection can lead to cause meningitis. Even it will enters into the bloodstream and can lead to cause CNS infections. We can call this infection spread from external ear to the central nervous system as malignant external otitis. And this external otitis in swimmers, we can call it as swimmer's ear. Even we can see it in people who are immune suppressed or in people who are children. In all age groups we can see this external ear infections. GI tract infections, people who have ingestion of these organisms through contaminated food, they can get this GI tract infections like gastritis or intestinal abscess. We can expect to see in these patients. It can cause eye infections, especially keratitis. People who are using contaminated contact lens solutions, or people who are swimming in contaminated waters, or direct inoculation onto the eye regions can lead to cause keratitis, and untreated patients can get blindness. These organisms can cause skin infections like folliculitis, cellulitis, carbuncle, furuncles and in these conditions we can see, especially in people who are having the skin infections, we can see one condition called erythema gangrenosum. This is erythema gangrenosum. On the right side we can see the picture, a photograph, erythema gangrenosum. At the central area we can see the necrosis of the tissues and surrounded with erythema. So we can call this condition as erythema gangrenosum. This specific word is widely used for the skin infections of Pseudomonas aeruginosa, erythema gangrenosum, and it can also cause folliculitis, hot tub folliculitis. People who are taking bath in hot waters, contaminated hot waters, because these organisms can grow at high temperatures, up to 42 degrees centigrade it can grow. So people who are taking bath in hot tubs, especially contaminated hot tubs, they will get this folliculitis. It can also cause abscess in the skin areas like furuncles, carbuncles, and the pus that is oozing from this skin abscess. Some strains always produces this pyocyanin and pyoviridin. Because of this, two pigment production by these organisms can make this pus that is oozing or draining as a bluish green appearance, and the pus samples also looks fruitish odor, because you can see a lot of organisms in these specimens, so it looks a fruitish odor even. It can cause bone and joint infections. So the organisms which enters into the bloodstream always have a chance of having bone and joint areas, especially the axial skeleton joints are get affected majorly when compared to appendicular skeleton. Diagnosis: in gram staining, these organisms are gram-negative bacillus with flagellas, and these are motile in fluid media, and these are non-fermenters because these organisms are oxidase positive, so that's why they don't require to enter into fermentation, and they're non-lactose fermenters even. On Mechanski saga, these organisms grow as colorless colonies. When compared to Enterobacteriaceae group, these organisms are non-lactose and they are oxidase positive. These organisms on blood agar culture medium, they are beta hemolytic and they produces bluish green colonies. And these organism colonies are always produce a fruitish odor, and these are aerobic in nature. So here on the right side you can see the organisms, Pseudomonas aeruginosa organism growing in colonies. Here is the bluish pigment, that is pyocyanin pigment secretion by this organism on the culture medias. It's a basic nutrient media without having much growth factors. Treatment: these organisms are resistant to antibiotics because these organisms always have a resistance gene in their genome, which is these organisms get that resistant gene by transduction and conjugation, and they can also have a plasmid, and these organisms can be treated with gentamicin, tobramycin, colistin and fluoroquinolones. So commonly used drugs are gentamicin and carbenzolins are frequently used to control these infections, whereas majority of the normally used antibiotics are resistant to these organisms. This organism is resistant to those antibiotics. Prevention is by isolation procedures, aseptic techniques, careful cleaning in the hospitals, monitoring of respirators, catheters and other instruments in the hospitals can prevent this infection. And in burns patients, we always has to use silver sulfadiazine, and which is supported with surgical debridement in the burns areas, can prevent the incidence of this infection.